So anybody who has chronic migraine is a candidate for Botox. So Botox is a preventive treatment for patients who have chronic migraine. So chronic migraine is when a patient is experiencing headache 15 days a month or more, and some of those days meet full criteria for migraine. You have preventive options, which are typically daily oral medications to reduce migraine frequency and severity. Botox is different in that it's a procedure. It's administered every 12 weeks as an ongoing treatment for migraine prevention. The procedure itself includes 31 injections in areas where the nerves are activated during migraine, so forehead, temples, back of the head, top of the neck. Oftentimes when I'm describing it to patients, you say, oh, those are all the places that I hurt, which is not a coincidence. The procedure itself actually goes fairly quickly. A lot of people are intimidated by 31 injections, but it's a very tiny needle, and I would say it takes me much longer to explain the process than actually perform it. The most familiar understanding that patients have with Botox is for cosmetic, so you know that it causes weakness in the forehead muscles, and so in the way that it causes weakness, it inhibits the transmission between a motor nerve giving information to a muscle and telling it to contract, and so that information is blocked by Botox. The same thing happens between two sensory nerves. So if a pain signal is coming down, it inhibits the transmission between two pain signalings. So in summary, it just decreases pain signaling in migraine. So anybody who has chronic migraine is a candidate for Botox. There are generally limitations more on related to payment by insurers, that it generally is considered a second or third line option after patients have tried and not had a therapeutic response or been intolerant because of side effects of oral preventives. So in general, if a patient's tried 2 or 3 oral preventives and not had consistent results or had terrible side effects, Botox is then discussed as an option. So actually, compared to the oral medications, we think of Botox as being very well tolerated with very minimal side effects. The number one side effect that we have seen in clinical trials in our experience in clinic is neck pain, generally right after, like the week following the procedure, probably not related to really muscle weakness in the neck, but more that you're injecting the trap muscles and other muscles almost have to make up the difference. And so a little neck soreness is not uncommon. Neck pain is actually really common amongst migraine patients anyways. The other is that it's not unusual to get a headache the day of the procedure or the day after. It takes them a couple days up to a week for the medication to be taken up and start to work. And in that time period, the needling itself is not particularly therapeutic for a migraine patient. So you need to have a provider, either your general neurologist may perform Botox, or if they are not doing Botox on a regular basis, sometimes they'll refer to someone in their practice who does the procedure or send out to a headache specialist who does it regularly. So the majority, I would say, of neurologists treating headache are comfortable with using Botox as a preventive treatment. So it's indicated in the treatment of adults. It does not have any safety data for use during pregnancy, although there are no known teratogenic effects from Botox. But generally, it's a treatment for lots of patients because it doesn't interact with any other medications. It wouldn't be appropriate for someone who has a history of a neuromuscular junction disorder like myasthenia gravis. But those instances are very uncommon. So I think Botox should be a consideration for anyone who has a history of preventive failure. So anyone who's coming to you who has experience trying a preventive and either had intolerable side effects or has had a lack of benefit where it didn't work. If they've tried 2 oral preventive medications, the next consideration, if they have chronic migraine, so 15 days a headache a month or more, you should be considering Botox as a preventive treatment because it's effective. And oftentimes a lot of patients they have fatigue about using continued oral preventives. They have an opinion in their head that, I've tried lots of oral medications, they don't work, I don't like taking all of these pills. And they're often very open to the idea of Botox being specific for patients who have chronic migraine, so not just the every once in a while headache that they may find more common amongst other peers. So in general, our expectations for treatment are that after the second round of Botox, so there's every 12 weeks. So with the first one, I set things up for the patient that the expectations are modest. If you get benefit, great. If you don't, it doesn't mean a lot. In the clinical trials and in our experience, it often takes a second or sometimes a third round to really see significant improvement. So the initial result might just be a reduced severity. I noticed that my abortive medication works better. I noticed that I'm not missing as much work, but I still have the same frequency when I do the numbers in my headache diary. So the expectation is that by the second or sometimes the third round, you're really seeing a reduction in numbers. If by the third round, there's absolutely no change in a patient's frequency of headache or the severity, then it may be time to reconsider or potentially add an adjunctive medication. Sometimes I say Botox doesn't work or any preventive doesn't work because it's a squirt gun on a forest fire and you just need a combination of treatments to kind of bring that burn down. So it requires a lot of back-end work in terms of initiating a prior authorization with their insurer, because generally most insurers require that you failed 2 oral preventives prior to treatment with Botox. So there's someone generally in the office who will initiate that with the insurance and receive prior authorization. Sometimes a physician may use their own stock of Botox and charge insurance. Sometimes they may need to order it through the patient's specialty pharmacy as specified by their pharmacy benefits. So there's a lot of behind-the-scenes work that comes with shipping it. And then if patients typically have coverage to a certain degree for Botox, but if they have significant copays, the company that manufactures Botox offers discount programs that they commercially insured patients could potentially use.